I'm Anthony Leeds, and it's my pleasure to welcome you to this seventh conversation with people who are experts in the management of obesity and related diseases. And today we're going to talk to Dr. Adrian Brown, who's a Senior Research Fellow at University College London. And we're going to talk about kidney disease. Now, for many of you listening, you may not think that there's an association between kidney disease and obesity, but there is. It's potentially a major problem, and it's potentially a target for weight reduction. So we're going to talk to Adrian. Adrian, thank you for meeting us today. Let's begin with the question of how much kidney disease is there in different countries around the world. So in the United Kingdom, for example, how many people are affected by kidney disease?
Tony, first off, thank you very much for asking me to talk about this really important topic. So when we sort of look globally, chronic kidney disease impacts around 10% of the global population. So that's over 800 million. So when we come down to, let's say, England, for example, there's about 1.8 million people currently diagnosed with chronic kidney disease. So that represents around 15% of the adults in England. And around 7% of those have more advanced chronic kidney disease requiring more advanced treatment. And around 30,000 of them are on the most extreme form of treatment, which would be what we call hemodialysis. So that means spending time on the machine up to around 3 times a week for several hours to filtrate their kidneys. Now, in addition to that, what we also know is there's around 1 million people that are currently undiagnosed with chronic kidney disease in England as well. So that represents a large number of individuals that have no awareness that they're currently living with chronic kidney disease.
Yeah. Now, the association with overweight and obesity has been known for some time, and there are other factors that sort of link the two together, like high blood pressure and diabetes and so on. Can you elaborate a little bit on that and how both of those conditions might influence the development of problems with kidney function?
Of course, Tony. And yes, you're absolutely right. There's multiple factors that can end up impacting on chronic kidney disease. The two main ones tend to be diabetes, which basically too much sugar or glucose in your blood can actually end up damaging the way that the kidney filters. And over time, this can damage, meaning that the waste that the kidney filters, because that's its role is basically to remove waste and extra fluid from the body, damages and it ends up building up in your blood. With hypertension or high blood pressure, what tends to happen is that high blood pressure can end up damaging the blood vessels in the kidneys. So again, they don't work as well. Now, there's other factors that can also impact it. Genetic factors, so polycystic kidney disease, or in fact, some certain drugs can actually impact and become toxic. But one of the main factors you said right at the start is obesity. And what we realize is that obesity itself, both linked to diabetes, type 2 diabetes, but also hypertension, but also the fat building up around the kidneys and around those filtration parts of the kidney mean that it doesn't function as well.
Yeah. Okay, so that then suggests that there may be scope for modifying what happens by reducing weight. And we know, and we've discussed this in some of the other talks, the effect of losing 10% of body weight and the effect that has on diabetes metabolism. And indeed, as you know, we talked to Mike Lean and other colleagues about diabetes remission. So it's an obvious question, that is to say, well, if we were to apply the same sort of effective weight loss and weight maintenance, would that be beneficial theoretically? And has anybody actually looked at it yet?
That's a really good question. And so to date, there's actually limited high quality evidence sort of weight loss interventions in people with obesity and kidney failure. So when we've looked at data, they've actually asked nephrologists. So these are the people that take care of people with kidney disease. And what they found is that there tends to be a lack of knowledge around the access of weight loss interventions, and also potentially that there's a little bit of what we call ambivalence, or they're unsure about what to do, so they tend not to necessarily treat the patients and focus on the kidneys. Now, a recent big review in the UK, this is called a Cochrane review, so this is one of the highest levels of evidence that we have, has looked at weight loss interventions. And what they showed is that things like weight loss surgery, energy restriction like the low energy diets, exercise, pharmacotherapy can lead to weight loss and health improvements. However, due to the fact that there's actually weaknesses to this data, to these studies, it means that it's difficult to draw conclusions as to the best way to actually engender or cause weight loss in this group. So there are some options out there, but they're very limited at the present time.
Yeah. So has anybody actually tried to achieve weight loss in any of these groups, and what have they found so far?
So there has been some evidence that has looked at trying to get people to lose weight in these groups. One of the first studies that was out there was actually from King's College London, and what they did is they did a intervention which involved exercise, calorie restriction, but also all of that, and they found some good outcomes in terms of weight loss, and some individuals actually got listed for transplant. Within our own service, when I was working clinically, I set up a group and a clinic to actually look at these individuals, and I'm really happy to say that we got a good group of individuals listed for transplant as well, and got them to also lose weight. The important thing was really around finding the right dietary method for those individuals, but also appreciating the challenges that they go through. Now, related to use of low energy diets in terms of formula diets, there have been some evidence out there, but these tend to be low quality and tend to be sort of more case studies. So we've used it in clinic and very small studies. So there has been evidence out there, but very limited at the present time.
Yeah. So there's very, very much a need for a much larger scale, better designed trial to be done, isn't there?
Very much.
Now, there are some other groups who we need to think about, but may not have the answer for yet. So, for example, when I was visiting Prague on one occasion to the Transplant Institute, I discussed with colleagues there the problems that there are with live donors, because as people listening know, often there's a live donor from a compatible relative, and sometimes they're not able to donate because they are too heavy. And we had some plans to undertake a trial, but unfortunately for a variety of complex reasons it didn't happen, which was a pity. Do you think that is a group that we could look at as well in order to increase the numbers of people who can go through transplantation?
Very much, Tony. I think that focusing on live donors will definitely help that. Now, the thing is that very, very few individuals actually have live donors available, and the large majority of them end up on on a transplant list looking for a different type of donor. And so this is called a cadaveric donor. And so, yes, it will help those individuals that have a live donor that they found there to get. Will it significantly impact the number of transplants going on the year? It might do in small numbers, but not significantly. And what we really need to do at the moment is focus on the individuals that are on hemodialysis, because that's going to be the best quality of life and potentially the best cost savings as well.
Yeah, good. But also there are the people who have very early disease and who, given time, are going to progress to more advanced disease. What would you do? Suppose you were given adequate resources to investigate this. I know it would require large numbers of people to be observed for quite a long time, 5 or 10 years or something like that. But do you think it would be worth doing, and what would you do if that was a possibility?
I mean, very much so. I mean, this is going to require not just weight loss, but weight loss maintenance, and then observing them over many years. Kidney disease tends to develop over many years, and also kidney function tends to deteriorate with age, and that needs to be appreciated by your listeners as well. As you age, your kidney function goes down. So if I had a large amount of money, well, yes, I would be looking at individuals that have lost and maintained body weight for a significant period of time, and then looking at the progression of kidney disease. If I was looking for an intervention that I could do and then follow these people up for many years, I would look at engendering as much weight loss as I could. So, for example, using a formula low energy diet, and then looking at long-term weight maintenance, and then looking longitudinally around what actually happens to long-term kidney function.
Okay, so that would be one possibility. Are there any other groups that we could look at, do you think? Any other? For example, there are the very large scale, or not large scale, but will become large scale interventions for diabetes. So in the United Kingdom, NHS England is rolling out its program, and the NHS soups and shakes diet, which appears to be very effective in achieving weight loss. We're still waiting for those results. I think they're going to be presented at the upcoming Diabetes UK conference to some extent. Would it not be worthwhile adding on observations of kidney function to those large-scale studies? Because that would be a way of collecting observational data on what's actually happening to kidney function, if the numbers are in the many thousands.
Very much so, Tony. I agree. I mean, that is definitely something that could be looked at in the long term, and may, in fact, be a good way of understanding kidney function in the long term. So might be something to look at.
Right. Okay. So finally, we need to think about what to say to most of the listeners here who may not be aware that they have kidney problems, or if they have the condition, it may be at a relatively early stage, in terms of what guidance we can give. And as usual, we'll provide some web links on the page associated with the video. We've mentioned earlier on that high blood pressure and diabetes are associated with the deterioration of kidney function. And so if we give you links to how to determine risk for diabetes, and also how to address the issues of high blood pressure, then that would be beneficial. But what advice, sort of straightforward advice, would you give to anybody who's a bit overweight, or indeed obese, who is aware that they've got a little bit of deteriorating kidney function? They've had a test which has shown this, but have no specific advice yet. What would you say? What would you say to them?
I mean, the first steps would be looking actively at your lifestyle. There is evidence to show that looking at your dietary quality, so very much things like salt, can be of benefit. So reducing actively the added salt within your diet. Physical activity can help as well, and getting more physically active, and looking at the overall quality. So looking at that plate, making sure that it's got lots of color on it, not a huge amount of carbohydrate, but also looking to reduce down that more processed food through the day. I would also recommend that if you haven't been to your GP for a while and haven't had a checkup, I would recommend that you go, have a simple blood test and see what's happening to your kidney function. Because as we said right at the start, that there's up to 1 in 2 people actually have undiagnosed CKD, and they haven't been tested or aware about it. So what I would do is I'd encourage you to go and see your healthcare professional, get some advice and get some support in order to help you to achieve the goals that you wish.
So anybody who has type 2 diabetes and who's in a management pathway would of course have their kidney function checked as part of the routine screening. What about people with high blood pressure? That would normally be included at the beginning of the management pathway, but is it checked at sufficient intervals in routine practice, do you think?
I would hope so, Tony, but obviously there might be variation in practice. So it might be the fact that you go and speak to your GP and encourage them and ask them to do the test appropriately.
Yeah. Okay, so let's just go back then to the key thing that I asked you early on, which is if I gave you adequate resources and time, what you would like to do would be to do, I presume, a weight loss trial in people with people in the middle of the range, say. That would be perhaps the group.
I mean that would hit a large number of individuals. If I mean obviously my interest particularly is in those with the most advanced type of kidney disease, and so I would be really, if I had money and hopefully some research will be coming out in the near future, that we are going to be looking at interventions to help people that are on hemodialysis to lose weight, and potentially get them listed for transplant. So what we do know is it takes up to 17 years for research to actually get to the patient, which is a huge amount of time. So any project that you develop would need to be very clear about how it was going to be implemented after it ran as well.
And that question of 17 years that you raise, of course, there are all sorts of factors that are involved. That's the subject for another conversation on another day, because there are reasons as to why that happens. So things have to be speeded up, don't they? Obviously, because the need is now, not in 17 years' time.
Yeah, very much.
So just the final point then is, have you any clues as to whether weight loss with using bariatric surgery or medications, GLP-1 agonists, or a dietary intervention would be more effective for this particular group, or at this stage, can't we say?
Well, there is evidence to suggest that bariatric surgery is still the most effective treatment for people living with obesity. And you get similar weight losses for those with or without kidney failure. The thing is that with bariatric surgery, there is evidence. The evidence is from small case studies, but also success varies. And actually what we've seen is there's actually generally increased complication rates after bariatric surgery, and not everybody wants it. With pharmacotherapy, these are options, definitely options for those with less advanced kidney disease. Because as you said, the GLP-1 receptor agonists, things like liraglutide, semaglutide, are renally cleared. So what that means is that you can't have them if you have more advanced kidney disease. But very much when we're moving forward, I think there's going to be some good options potentially from a dietary point of view to help people in the future, hopefully.
Okay. Excuse me. So thank you very much indeed for, excuse me, oh dear. Thank you for talking to us. I wish you success with your program over the next 5 years. But I intend that we come back to talk to you again, maybe about that 17-year delay between producing evidence and it being moved into, translated into practice, which is a serious. We'll talk about that on another occasion. So Adrian Brown from University College London, thank you very much for talking to me. Thank you.
Thank you very much, Tony. Thank you.